Welcome back, ladies and gentlemen, to another fabulous episode of the Healthcare Trailblazers podcast. Excited to be sitting here today with Natalie Davis. Natalie is the CEO of a very interesting organization called the United States of Care. We're going to get into exactly what you guys do and the good work that you're doing and what you're trying to affect for the country at whole. Natalie, thank you so much for spending time with us today.
Thank you so much for having me. I'm excited for this conversation.
Absolutely. So, where did you grow up and what was your interest in? Where did your interest start in health and policy and both? Talk to us about your origin story a little bit.
Oh, I love that. I grew up in Columbia, Maryland,
Okay.
just down the street from DC, where I live now with my husband and 4 kids.
Wow.
My husband and I actually met in high school, and so we're high school sweethearts. And
Nice.
my interest did not begin in healthcare. My interest from the first time I thought about what job I would want was actually just wanting to start something. I loved the idea of creating something, a platform, something to tackle a hard problem, not knowing what that was. And when my first job, it was going to be a daycare because I wanted to start my own daycare.
Okay.
And then
Kids or adults?
Kids.
Okay.
And then went to college in state school in Maryland and found that I loved the concepts in sociology, and I married that with art history. I loved the individual and the society and how they interact through sociology studies. And then for me, it was then how does that show up in art? And so had a ton of fun in that.
How does it show up in art? Sorry.
Yeah, lots of different ways. One of my the artist that I think about the most when I think about that is Frida Kahlo, who I came across her work first when I was in Mexico with small town Mexico in middle school, where my good friend, her family lived, and we were coming back from Mexico to Maryland, where her family was running a Mexican restaurant, and we were going to farmers markets and flea markets to buy local art and pottery and silverware to bring back for the restaurant, and got to know Frida's work there. She has a very strong face, a really strong eyebrows, really painted really masculine features on herself, at the same with very feminine features, and really at that time when she was an artist was really thinking about how do you show up as in art with all these different complexities as an individual. She also was in a car accident when she was growing up and had to have multiple spinal surgeries, and found her love of painting by laying in a bed and had a mirror over her bed and would paint herself portraits.
Wow.
And a lot of that then had health infused into it. Now looking back, and how, your body is healthcare is about our bodies. I think we forget about that a lot. All parts of our bodies, from our brain to our physical body to our mental health. And that shows up in lots of different ways in art. And so I thought I was going to come to DC and work at the Smithsonian, where I had an internship, and got here while my husband was in law school. And everybody told me it was going to be really hard to get a job. People from around the world come here to work at the Smithsonian, so it's going to be really hard. And so I just gave that up. Looking back, I gave up really quickly.
Did you even send in a resume?
No, I just they were like, it's hard. And I was like, oh, okay. Right. But then worked with a headhunter who looked at the different things that I studied in college, which was, the mental health, or I didn't call it that then, but depression and suicide and anorexia and bulimia and food deserts were just being talked about. But to me, those were society issues. I didn't think about them as healthcare issues, but they said, no, this is healthcare. Go work in healthcare. So that's how I ended up in this field.
Wow. So it sounds like did you come to DC because your husband was in law school there, or were you always like, I want to go to DC and do something?
Yeah, it's a good question. I wanted to come to DC to work in museums.
Okay.
And gotcha. He was an immigrant. He studied immigration law and, found a great school at the University of DC. And so we loved, while it was close to home, 45 minutes away was the perfect distance. We still have family in Maryland, which is a blessing, and love being in the city that we call home and are raising kids in.
That's incredible. Yeah. So how long after you moved to DC did you start United States of Care?
Oh, that's a good question. So I worked for the Obama. Well, I worked at a couple of organizations in DC. Was at NCQA actually writing HEDIS
Oh,
measures.
cool.
Yeah, writing HEDIS measure specifications when the Affordable Care Act was passed.
Nice.
And there was basically a startup within the federal government that was working on implementing what now is healthcare.gov and the marketplaces. And at that time, they were looking for someone to come in and help the quality standards, quality measurement program for the marketplace. So I was asked to join the federal government and just had a blast working on really what was a startup within the federal government. We were writing policy at the same time as we were building teams and we were building operations and we were building websites. And it was my the first time I realized that what I loved about healthcare and healthcare policy was implementation, and more specifically implementation and if it matters to people. Are we meeting the needs of people across this country? And that comes down to outreach and education and implementation and working with partners. I loved that work. And then when Andy Slavitt became the administrator for CMS, we had a quick conversation. I thought I was on my way out of the government. He convinced me to stay and work directly with him as his senior advisor. And it was a great, great experience, really understanding how, how the government can play such a strong role in setting a strong path for the healthcare system, and build responsive policy. And got outside of DC for the first time and really understood what the healthcare system looked like from across the country by talking to people, by talking to providers, talking to entrepreneurs and governors and reporters, anybody who was in healthcare. It was such an amazing time to really get such an interesting perspective on the healthcare system and then understand how you can use that to build better policy.
Wow. So how many years were you actually working in the government?
About 8 years.
Wow.
Yeah.
Okay. Quite the career there. And the NCQA was before that?
NCQA was before that. I was at the Association of American Medical Colleges working in their editorial office, which was a blast. And then I also worked at George Washington University School of Medicine in the dean's office while I was getting my master's degree there.
Very cool.
Oh, yeah.
Wow. So you obviously saw, so you're working in the government and you're seeing the strong role that government plays and what it can affect. It sounds like you saw that there was something missing though between how the government, like what the government says and then what actually happens on the ground. What was that missing piece that you felt was missing?
Yeah, I think a great example is one of the most impactful site visits we did was to a community center in a city where there's a community center where they were bringing together mostly people that had physical disabilities or needed aids another way, but a place where people could come and socialize, could have art classes and music classes, community center. But they walked us into the back where they basically had a chop shop for wheelchairs, where Medicare does not cover the cost of a lot of maintenance and upkeep and changes that people need for their wheelchairs to accommodate changes in what their body needs at that time, or to if something breaks, or if they if they have injuries from being in the wheelchair. And basically they had to create something where they were teaching people how to fix their wheelchairs, because the federal government, their insurance program, forget the federal government part, their insurance program, Medicare, doesn't cover the cost of what people need to be able to have the support that their lives depend on to be out in society and with their friends and community as they want. And taking that back and talking to the policy folks and our in CMS and understanding, why is this the case? What can we do differently? This can't be the case, and it still is the case, and there's been made some improvements, but it was such a moment of like, as someone who loves building stuff with their hands, and my dad is a woodworker, seeing like, wow, this is so neat, like a chop shop to fix wheelchairs. And then you're like, wait, this isn't what it should be. Why is that? And that just really, that there's many moments, but that one really stuck out to me is where policy has a direct impact on people's lives and livelihood.
Absolutely. So at what point did you say, okay, my time in government has been really interesting, but I think I can do something in between, I'd say, government
Yeah.
and private practice?
Well, I had it twice. One is
Okay.
when Andy convinced me to stay and keep
Right.
working with him.
Right. That's true.
Uh,
So what were you going to do? What were you going to do when you were leaving
I don't know, I
the
just
first
wanted to go work in the private sector. When you grow up in Baltimore, Maryland and the DMV area, like our industry is government. My mom worked for USDA, my stepmom worked for SSA, like everybody's parents works for the government. And so I didn't really even understand, unless like all of my siblings, unless you're a nurse, teacher, work for the police or fire, UPS, like I didn't even know what else it meant to work in the private sector. And so
day? Okay.
somebody had introduced me to Andy, because I was like, maybe this guy can teach me about get me a job at this place called Optum. I have no idea what Optum is, but he can teach me about it. Just really getting, I think it was an itch to find out another way of healthcare, how it works. I'm a very experiential learner, and so being out there and wanting to see different ways it works was really intriguing to me. Thankfully, I stayed and got to work with him. But then when the Obama administration ended, Andy and I both left the CMS and realized that we had a lot more work we wanted to do together. We at that time, that summer was the summer of repeal and replace, where there was a lot of discussion about taking away a lot of the really important life-saving parts of the Affordable Care Act that people came to rely on. And we saw a real moment of people across this country saying Medicaid is important to us, coverage is important to us, we can't go backwards. And it got us thinking, we need to capture this moment of listening to people. We need to figure out how to build a healthcare system by finding common ground among people. You could call them voters, but first they're just people, and wanting to kind of harness that and paint a picture of where we can go as a country, if we find these commonalities. And so that's what we set out to do. So while we started United States of Care, we also were starting Town Hall Ventures, which is a venture fund that is investing in solutions that are serving, hard to reach communities or vulnerable populations or others that are often ignored by the healthcare system. Um, and doing a lot of other work. It was such a neat time to build a couple of things at once that we're all trying to attack the same problem of access and affordability, but from different levers.
Huh. The fund is a new thing, or this started at the same time as the United States of Care?
Started at the same time, so both are about 5 years old this year.
Okay.
Town Hall Ventures is still up and running. I mean, they're doing amazing work over there. Raised their third fund and are investing in some really, really cool entrepreneurs and companies that are making a real difference in healthcare delivery.
That's incredible. What are some of those highlights? We love healthcare entrepreneurs over here.
Yeah, I'm happy to make some introductions.
Fascinating. So that was the impetus for starting United States of Care.
Yeah, it
So
was. It was.
simply put, what does United States of Care do?
We are seeing a shift in this country where people are asking our institutions, education, healthcare, to do better, to deliver better on the promise of what we need them to do for our society. This gets back to my passion about society and the individual, and they interact. And we are setting a North Star of how we can fix our healthcare system by finding the common needs across people. So we've done something that some may say is impossible. We have found 12 areas, 12 issues that people across this country, race, ethnicity, political affiliation, geography, income, have all said matters to them and that they want
Give me one.
common sense
I'm
solutions.
fascinated.
I know.
What's the issue that both Democrats and Republicans agree on?
Though there are many, and the one that I find very fascinating is providing support for caregivers who care for loved ones at home.
Okay,
That
I
is
see that.
it's a human
Talk
issue.
about it a little bit more.
Yeah, I mean that's that one specifically. It's a human issue. We're all especially during the pandemic, we all felt it even more when we were either with our family
Mhm.
or very far from our family. Caregivers are the people who either say they call themselves caregivers or they are performing that duty for someone in their family, are carrying a huge burden and get no support from our healthcare system, from our education system. They're doing it sometimes out of love, sometimes out of burden, but either way they're doing really really hard work, and they need help.
Yeah.
In healthcare, when we talk to people, we always are out talking to people. We've talked to thousands and thousands of people across the country, and when you talk about caregiving, usually in policy circles, that means, are there waivers to make sure that people are getting benefits at home, or there's a big push right now at hospital for at home. But what people need is support. They need care where they can have a break and they know someone's helping a loved one at home. They're taking them to the doctor's office, or they're taking notes for them at the doctor's office. They're helping fill prescriptions. It's a relentless wave of really important role that people are playing, but it takes a big toll on the individual's mental health and how they cope and how productive they can be in their lives. And
Right.
so that one actually was the one that spiked the highest with Republicans, is wanting the most change in, is really providing that support. So that's an issue that we're taking on, as well as lots of others across the country are thinking about. But I think this is going to be one of the next big issues we need to take on as a country.
I love it. I absolutely love it. So the country is incredibly divided today with social media and everything amplifying everybody's opinion, and the fact that most social media platforms um, seem to reward controversy and stirring things up, and that only amplifies the divisions in this country. I think there's probably never been a more difficult time to try to do work that you're doing. um, I, you have your political leanings, I'm sure, and trying to bridge that gap and find things that are really truly meaningful to people on both sides of the aisle, I can imagine is incredibly challenging. How do you even go about navigating that? What does that look like?
Yeah, you call it challenging. I call it extremely rewarding, and I
There we
mean that
go.
truly. No, I mean that truly. It is the thing that fills my cup the most, is talking to people. And so the way we did it is it started with me having a conversation with at a kitchen table in San Diego. I did listening sessions across the country, on the streets of Philadelphia. It turned to Zoom pretty quickly. Small conversations, one-on-one conversations, and we would ask the same questions of everybody. And really, what's so rewarding to me is we weren't forcing finding commonalities. I had no idea if we were going to find 12 issues or one. We were just listening to people and hearing what is the common theme over and over and over again that we kept hearing. And we did that for a year, just listening. We asked the same questions, take it in, think about it, analyze what are we hearing. um, and
Did you go
then
to any right leaning areas as well?
yeah, we at that time there was Zoom, because it was, but yeah, we were
Yeah.
talking to people of all political stripes, and race and ethnicity and income and geography. And what's something that was so, as a tangent, something that was so interesting to me is, and I'm still obsessed about it, I think about it all the time, is I would call people and they'd say, Natalie, I'm happy to talk to you. I understand what you're trying to do, but like, my story is so unique to me. I'm either too stupid or I'm too smart. I'm too
Okay.
sick, I'm too healthy, I'm too rich, I'm too poor. That I'm really bad at healthcare. Like, I fail at it. So I'll tell you what I'm saying, but it's my own failing at this. And then they go on and tell stories that were definitely unique, but a lot of similarities of really not being able to navigate this, of hacking the system to find your provider that'll text this cancer center that will let your mom visit with you. Like, all these ways people are trying to navigate this completely complex system and feel like they're failing at it. They know the healthcare system isn't working, but they then divorce that when they think about their individual experience, and they think they're failing. Um, and I'm just obsessed with that. Like, what does it look like to let people know that it's a system that I think is failing? And that's
Hmm.
what we need to do in order to drive change. and it's not a burn it down. It is targeted, incremental, real impactful changes that people will feel in their community, in their pocketbooks, and their family's health. And that's what we heard from people. That's what they want. They don't trust a big overhaul. They don't believe it'll get better. They don't, and they're risk averse. Even if I don't like what I have, you can't take it away from me, because what you're going to give me is worse. So fix caregiving, fix maternal health, fix my dependable coverage, and if I can afford it, fix the cost of my prescriptions. And that those are the sort of changes that people want, and it's our North Star on the issues that we work on.
That's amazing. So it sounds to me like what you were doing with, and correct me if I'm wrong, but it sounds to me like what you were trying to do with these meetings is, instead of kind of being like a reporter, almost like conducting a poll, that are obviously, if you read any books about psychology, persuasion, polls are completely garbage in a sense, because you're basically saying like, do you like this? Do you care about this? That, and you're like,
lipstick on a pig.
exactly.
Yeah.
So instead of coming to people and being like, do you care about abortion or do you care about the Second Amendment? You're saying, what
Yes.
are the things that you care about, and then trying to aggregate and find national commonalities that people
Yes.
think that they're unique, but they're not, in fact. And it sounds like you found 12 of those buckets.
That's right.
Accurate?
That's right. And it was from listening. We call it, authentic listening. It was a long time of having those conversations. And I would say we then did move to more qualitative and quantitative studies to make sure what we heard was right. Like, we wanted the numbers to back up what we heard. And so we have a very rigorous research program that I love nerding out on. We did that more of that authentic listening. We move into qualitative research, where we can have people interact with the concepts that we thought we've heard, move to quantitative to put in the numbers, move back to qualitative, and then back to quantitative to really make sure that we're validating what we hear, and then putting the numbers behind to show that there's agreement, because I think that part is really important.
Yeah, that's really interesting. So let's talk about the roles of big and small, let's call it big and small government for a second, because while it's really interesting to be able to find these national common issues, as you know, the country is very, very large, and especially now with I think us societally moving into appreciating more about diversity and equity, and making care more equitable to very specific communities. The challenges that different communities and different demographics face can be very unique, and they can be unique to them. So it seems to me like, on the one hand, you may have these large, broad stroke national issues, but then you also, even if you fix that, you've got all these small issues that are maybe unique to the smaller company, to the smaller demographics and smaller sub communities. So try to formulate this into a question. It's more of a conversation. It's more of a conversation because I'm curious your thoughts on what is the role of like big government, things that could just be fixed from the top, versus maybe there are certain areas where that's not the right approach, and in fact we need to empower the small local communities to be able to fix their own problems.
I think the issues that we have in healthcare are so vast that I think we need changes in leaders and innovation at policy and delivery innovation at all levels. I'd say our approach to change is really working in states where, and so I don't know if this gets to your definition of small government, but we believe that it's really important to go to states where they are the elected officials and others are meeting the needs of the people really directly in their state. And so a lot of the work we do are in working with states, legislators and governors and others to say, we're a national organization. We're not going to come in here and tell you what you work on, but we, from our, knowing you or hearing about it, it looks like you guys are trying to work on, making sure more people have access to affordable insurance. So we come in and we help move that cause along, sometimes in the background, and never take or get credit for it, which is just great. Like having a state be able to solve an issue that, through the listening we can do in that state, or the public opinion we can do in that state, the policy expertise we can help bring, is something that we think is really important. And we like to lift those up and show other states, here's what the state did. It's not going to work copy and paste in your state, but this is another way the state tackled it. Does this work for you? How can we make this a one that works better in your state? And then, there are times where we believe that we need a national discussion on an issue, or there is a role for Congress or the administration to take something on, but it is based on not just work that's happening in the state at the policy level, but entrepreneurs who are working on something. Often when we're working with policymakers, we're bringing advocates and everyday people and entrepreneurs and saying, here's in hospital systems, here's all the different ways different groups are tackling this issue. Here are the policy problems that they're facing or the barriers. Think about this as you're working on your next piece of legislation or your implementation at CMS. And we found that, as we think about some of the big, bipartisan omnibus bill that went through at the end of the year, that was a real moment of looking at, let's take virtual health, virtual care, digital care, health. We had a lot of tests over the last 2 years of what's working and what's not, and paying different.
Yes, we have.
And we saw Congress say, okay, let's keep this going. We've learned some stuff. We can, move. We can put up some parameters. We can think about it, but it is a real tool done well to increase equity. And I just took you on a really long tangent from our state-based.
No.
Work, but
like I said, it's a conversation. Yeah. Yeah.
How do you think about it?
I flipping the tables here. No, I think on the one hand, I feel that it's very interesting to me that you're even able to find 12 common pain points for the entire country. I find that to be incredible, and like kudos to you guys. That's really phenomenal to be able to do that. Like I said, being able to bridge, go across the aisle, and find those common things sounds really incredible. So on the one hand, if there is a common issue, if you can really find those common issues, then possibly policy from the top down is a good route. It's just interesting to me, the dynamic between like the national issues, but then we also are trying to focus on, the whole idea of equity in healthcare is more minute. Is saying like, okay, your community's got these, I shouldn't be delivering care to you the way I'm delivering care to these guys because you are not the same, right? So we want to give people in their own kind of flavors and
you bring up a really interesting point. And I think, as we think about building, so we run state campaigns and federal campaigns. We also have a solutions innovation lab where, our country doesn't have all the answers for sure on a lot of things. And in our lab, we take on an issue. Caregiving is one of them. Virtual care is one of them, where we say, we don't have good policy at the moment on this issue. Let's have a big tent and a welcoming table to bring all these different people from across the healthcare system, including everyday people, patients, to say, let's take on this issue of caregiving. What do we need as a country, state, community, federal? What are some solutions we need to build? Usually policy solutions, but not always. And to your point, how do you build in all these different community needs? How do we make sure that our policy is responsive to this new, it's not new, but the nation's discussion right now on different communities need different things, and how do we build that into policy or give leeway so communities can do those things differently.
Right. So yeah, because I feel like often the federal government's the job, so to speak, or the trick is that the policy should actually allow them to get out of the way of some of the local governments, so that the local governments can actually empower the local governments and give them the funding or the opportunity, but let them make the decisions on what's going to be most effective for their subpopulations.
Yep.
But let's talk about your policy expertise for a second, because and I've heard this from a number of different healthcare leaders, people that have been on the podcast. There seems to be a little bit of a concern of the disconnect between Congress, who's actually writing the rules, and then the actual boots on the ground. And it seems to be like you guys are doing a really, really great job at bridging that gap and talking to both sides and trying to connect them. And that literally is something that I've heard concern about. And like, how do we make sure that what we're actually seeing effective on the ground is being communicated to Congress? And to your point, telehealth is a great example of that. Like there are providers that are concerned that that's going to go away with the end of the, emergency declaration.
Mhm.
So what kind of, who are you talking to on the Congress side of things, and how do you engage with both sides? How do you engage with government, and how do you engage with providers on the ground?
It kind of comes, well, first we always start on, this is what we heard from people. This is what people want. They, um, we, one of the themes we've heard was people want personalized healthcare. And I'm like, and I was like, guys, we got to go back to the field. There's no way people are using the word personalized healthcare. Cause like in
Okay.
healthcare, that means something specific. It's your genome. It's, and we kept talking to people and they do use the word personalized, but what they mean is we can get healthcare when we need it and how we need it and
Mm,
where we need it. So in the home, texting, in my school, in the community. And so when we talk about virtual care, we always start with saying, here's what people want. Here's the experiences they have. Here are, when we do root cause analysis, here's where, if this isn't done well, it's going to make disparities worse, or it's going to leave these groups behind. And here are barriers that we're facing in order to like move forward this promise of what could be. I'm not going to say it's the thing that saves us,
right.
but here's where we're seeing some barriers. And so what we do is we create a space where we can bring a policymaker and bring in front of them different points of view on the same topic. And I say, y'all, when you show up, you cannot lobby. This is not lobbying. They're here to learn from your experiences. Whether that's CMS or somebody, a member of Congress or a state legislator, they're here to learn from you, and you're the experts to tell them about what's working and what's not. I think those sort of unguarded kind of conversations have been really beneficial. After
That's
working
incredible.
in CMS, it's hard to it's a hard place to sit because you do feel like you're being lobbied all the time. And people make a lot of money in healthcare, and there's a lot of money on the line, and there's a lot of power on the line, and you're always feeling like that. This is a lesson to anybody who's going to CMS: the more you can not lobby or make it seem like you're lobbying, the more successful you will be. Because you never feel like you have the whole story. You're wondering what you're missing. And so for us, really trying to create those spaces where we can have those kind of conversations has been really, really important to the way we do our work. And building that, your question was, how do you build that bridge between it, is, going back and saying, I'm hopeful of the next 2 years, as Congress is thinking about, the flexibilities they had for virtual care, they only put in place for 2 years. So we have 2 years to see, are the digital health as virtual care, is it working? Is it meeting people's needs? Is there a lot of fraud? How do we create and even more, just as important, is like, how do we make sure virtual care isn't just like a copy and paste of a crappy in-person experience? Like, can this be something different? And so, those are the conversations we need to be having over the next 2 years. And doing so sometimes through reports that we're doing, podcasts that we're on, but also some of these smaller spaces where people can have those honest conversations.
That's honestly phenomenal. Do you do any of those in person, or are they typically virtual these days? You mentioned.
Virtual has been great. We've done a couple in person, but yeah, it's been nice virtually. I mean, you just can hop on from
Yeah,
anywhere.
yeah, for sure. Um, that's really awesome. So for providers, I mean, do you do outreach to what kind of healthcare organizations do you try to target to be mouthpieces for the general area?
It's a good question. We're always looking to have more people to talk to and learn from. And sometimes, even if it's not directly with policymakers, it's working in an innovation lab. And, right now we're looking at caregiving and maternal health. And it's just, as we become, broaden our network and talk to people, that's kind of how we're built right now, to continue to look for the luminaries and the way people are delivering care differently, meeting people's needs. And, those are the people we want to be thinking about, different populations and how to make a fair healthcare system. Those are the kind of people we want at the table.
That's amazing. So how could people get in touch or get involved with United States of Care?
Yeah.
If
Well,
someone's
first,
like, I really care about something, how do they let you know?
that would be amazing. Well, you can go to unitedstatesofcare.org, and on there you can find United Solutions for Care, which are the 12 solution areas that people across the country say they want us to work on. And all of our emails are on there. Reach out. We'd love to have people involved. One of the things, and I'm thinking is interest to you and your listeners, is we talk a lot about value-based care, and the way we kind of come about that is differently. You won't see that on our solutions agenda, but what you will see is these issues that people want us to work on. Let's take personalized care. They can get care differently in different venues and stuff. It's impossible in fee for service, right? It's like
Yeah,
the only way we can build this healthcare system people tell us they want, is by paying for care differently. And so we have a lot of work that we're doing on, how do we translate what people want from this healthcare system to the promise of value and paying differently, to make sure that policymakers and others are talking about this in a way that resonates with people and shows the why of value-based care, and not about the deficit, not about the how we pay providers. That's all part of it, but I think part of the conversation is why do we need this for people and patients?
incredible. If there's one thing that you would like to have done, affected, bettered in 10 years from now through United States of Care, what would that be?
We will be in the conversations, carrying the stories and needs of people across the country to these tables that are often filled with lobbyists or other great actors, but there's nobody out there, I think, sitting at these tables and saying, here's what people across the country need and want. We have the policy and political smarts to back that up, but we will change the course of our healthcare system and the reform that we have, because we're going to center it on what people want.
Phenomenal. Natalie, I think that the work that you guys are doing over there is really incredible. It's very heartwarming and incredible to see people, and there are people on both sides of the aisle trying to do this. Unfortunately, they're few and far in between. So it's incredible to come across such an organization that it is trying to find those common issues and not just focus on the areas of contention, and try to bring some unity to the country, and specifically in a very divisive area of the country, which is healthcare. So I think that the work that you guys are doing is commendable, amazing, and I wish you nothing but the best of luck. I think it's going to be really interesting to continue to follow the work that you guys are doing, and I highly recommend everybody to go check out the site, see the 12 things, get in touch. Yes. Send Natalie a note or an email or something. Tell her what you care about. You want free toothbrushes or something? I don't know, but yeah, thanks so much for spending time with us, and
thank you.
Tremendously best of luck.
Thank you so much. This is a great conversation.